And if you are tired of bedside or you're burnt out, I definitely recommend that you look into CDI. Hey guys, it's Noreen and thank you for making it to my channel. I appreciate you for being here. Welcome. And in this video, I'm just gonna do a little quick comparison with bedside versus CDI. So if you're a nurse that's burnt out, considering leaving bedside and you're looking to change into another career, I am a CDI specialist. So in this video, I will be comparing the two, bedside and CDI. So first things first is we all know bedside can be very draining, exhausting. It can definitely burn you out. So with bedside, you know, you're definitely hands-on with your patients. You're helping your patients in real time. So I would say that's one thing. So with CDI, CDI is more mental than physical. I've said this in many of my other videos. So with like bedside nursing, you know, it's a lot of wear and tear on your feet, a lot of wear and tear on your body, a lot of pushing and pulling, a lot of physical stuff that you're doing, and eventually that will burn you out, right? Versus CDI, it's just more so mental. Like, you will be mentally fatigued. It is a very steep learning curve. I've stressed this a lot in my videos, and I've also shared many tips on how you can, you know, prepare for this stuff in advance. It is definitely a steep learning curve because what it is you're no longer thinking like a nurse as a CDI. You're mostly thinking like a doctor. Because, for example, when we're taking care of a patient and that patient's desatting on the floor, they're tachypnic, right? What do? We throw some oxygen on that patient, right? Then we're calling the doctor, asking him if he wants to get a chest X-ray. We're calling RT, asking RT to give a breathing treatment if the patient has a PRN breathing treatment, right? So these are the things. We're auscultating, listening to their lungs. Like, these are the things that we do as nurses, right? So we're taking care of the patient, but we're not putting a diagnosis on it. We're not saying, hey, this patient has acute respiratory failure, because that's essentially what it is. Like, if your patient desats less than 91% on room air, excuse me, oh my gosh. If your patient desats less than 91% on room air, they're tachypnic. You want to get a chest X-ray, see what's going on in there. They got to get a breathing treatment. They have to get O2. That's acute hypoxic respiratory failure. So like I'm saying, as a nurse, we're not thinking about it like that. We're not thinking, hey, this is the diagnosis. We just know how to treat it, right? And so that's the thing with CDI. Transitioning from bedside going into CDI is you have to be able to make that connection while reading the chart, because for us, we can easily see it, but we're not going to put a diagnosis on it. So that's the thing with CDI, is that you have to learn how to make that connection, putting these diagnoses on things when the diagnosis is not there. And it's the same thing with the doctors. The doctor's treating this patient, right? They can be treating this patient, ordering antibiotics. Turns out the patient has pneumonia, but the doctor won't say respiratory failure. So then as a CDI specialist, it's your job to send that query in to ask for the acute hypoxic respiratory failure. So that's just the best way I could kind of connect the two, the bedside with the CDI. But so yes, so that's why I say, like, it's a steep learning curve. Just because you're using your nursing knowledge in a different way, you're still using your clinical knowledge, you're still using your critical thinking skills. It's just in a different way. So that's that comparison. And so again, bedside is just more physical. CDI is more mental, but it's definitely doable. Obviously, bedside, you have to be with the patient in the hospital. CDI, you have remote options where you can work from home. So that's obviously very ideal for most of us. And definitely the work-life balance, I would say, is definitely better for sure. Working from home, right? Who doesn't want to do that? The only thing I would say is that if you are a person that likes to be hands-on with your patients, communicating with your patients, and actual like patient interaction, you might be a little, CDI might be a little questionable for you. If you don't like being isolated, CDI might be a little questionable for you, because you are basically by yourself. Like, you can reach out to your team members via Zoom and all that if that's what you want to do. It's an opportunity, it's an option, but it's not likely. Like, you're working by yourself. So if you're someone that also likes to work with other people and all that stuff, I don't know, at least remote, you can probably find your CDI job that's like in an office or something with other people. But me personally, I'm an introvert. Okay, so I have no problem working from home by myself, isolated. I can get my work done, no issues. And so that was one thing. But I will say this though, with CDI, so since you're not actually helping your patient, you're still improving patient care. You're just behind the scenes. You're improving the documentation, making sure that the patient's diagnoses are accurate. So that's one thing I would say. But I do miss helping my patients. Like, I used to like visit my patients. Like, as a travel nurse, you're on one floor one day, on a different floor another day. I used to literally go and visit my patients. Like, when I was on a different floor, my patient would be like, "Come see me tomorrow if you're here." Yeah, I would go see my patients. Like, so I will say I definitely miss that patient interaction. But it's okay. I'm okay. Like, I'm really okay. It's okay. But that's just something to give you to think about. The other thing I would say about the two, I already told you about the physicality and the mental health, the bedside, the thinking. So the other thing I wanted to talk to you about is about the energy at the end of the day. So I feel like with bedside, at the end of the day, I was drained. I was tired. I didn't want to do nothing. Like, I was drained, right? Versus CDI, you're drained, but again, it's not physical. It's more so mental. Like, it's just like, ugh, I don't even want to think right now. I just want to relax, okay? But like, CDI, at least after work, you can still go work out. You can still enjoy your life. You can still go do things. So it's not like the same as with bedside. So that's definitely something I wanted to point out. The other thing that I would say is that as far as growth goes, with bedside nursing, you would become a manager. You would move up that ladder. Things like that. Versus CDI, you can still like move up the ladder. They have auditors. You can be a manager as well. You can be an educator, basically like a preceptor for incoming CDIs. You also have the opportunity to do consulting. So there are many opportunities to move up that ladder as well. All right, y'all. So a few things that I also wanted to add to the video, the pros and cons of CDI versus bedside, is the scheduling. One thing I did like about bedside nursing, especially being travel nurse or all that good stuff, is that like whenever we wanted time off, we can just fix our schedule to take the time off, like, or just not work or not have an assignment or whatever it is we wanted to do to have time off. Like, I didn't really I've been mostly a traveler, working PRN most of my career. I probably, out of my 10 years of nursing, I was probably staff nurse for like 1 year and some change. But I was always travel nursing, and I was always able to get time off for the most part whenever I needed to. So like, that's one thing I will say. Versus CDI, you are in a staff position, unless you have a contract, of course, but you are in a staff position, so you do have to request time off. I don't really like that, I'm not gonna lie, but it is what it is. Like, I'm just so used to being like PRM, per diem, and just not picking up when I want to be off. So that's one thing I will say you do have to keep in mind. The other thing is that since it is salary, as a nurse, right, you could be like, "Oh, I'm gonna pick up a shift or two. It's gonna cover my trip." Or, you know what I mean? Like, "Oh, that's just a shift. I'm gonna pick up an extra shift, and then I'm gonna pay for this or pay for that." Versus with salary, you don't have that option. Whether you're working more or less, well, it's good if you're working less, right? You're still getting paid. But if you're working more, you're not gonna, like, you don't get compensated for those extra hours. So if you're working a little bit extra, a little bit longer than you expected, you don't get paid extra. And I don't like that, honestly. It's not ideal. It is what it is. It's definitely something to adjust to, especially being nursing, like especially travel nursing and PRN. Like, we can pick up an extra shift and literally pay for a trip. Like, I just think that's definitely a pro of bedside. And then you don't really have that when it comes to CDI. Like, there's just no way you can really make extra money unless you get like another job, a side job, or whatever. So like, that's like another thing to to think, well, not to think about, this is something to consider, because at the end of the day too, the benefits of CDI is work-life balance. It's like peace of mind. Like, you know, you don't have to stress about going into the hospital and dealing with patients and management and all that stuff that we have to deal with working at bedside. So it really comes down to what you want and what's important to you. Like for me, my priority was peace of mind. Like I needed a work-life balance, a peace of mind. All that other stuff, like it balances out, like it weighs out. For me, the cons definitely weigh out versus the pros going to bedside. Like, so it also, so that's the other thing too. Like, I just really want to stress to you that it really depends on what you want. Like, are you looking for a peace of mind? Like, are you willing to like maybe take a pay cut, work a little less, or make a little less, maybe work a little more, but for peace of mind? So like, that's also something that you have to take into consideration. The other thing is too, you know, some people think just because you work from home, you can't be tired after work. I be tired after work. Like I said earlier, like sometimes I don't want to talk to nobody. I don't want to think. I don't want to do nothing. I still be tired after work. Work from home is not chilling all day. Like work from home is exactly what it is. You're working from home. So that's also something to just take into consideration, because I know a lot of people think, oh, it's going to be chill, easy, yada, yada, yada. No, you're working from home. But like I said, I definitely recommend CDI. I know a lot of nurses are very hesitant into getting into it, but I recommend it. Like, I'm so glad I took the leap of faith and actually did CDI. Like I said, it is a steep learning curve. It did take me about a year to get comfortable doing CDI. Like, I'm not gonna lie, at the beginning I was struggling, but I'm in a much better position now. I'm almost going on like a year and a half now, so yeah, it's definitely worth it. If you guys have any questions, let me know. I am probably gonna do a chart review or something like that later. So that's another thing too. Y'all gotta let me know. Do you guys like those chart reviews? Because I feel like, so when I started with CDI, I was on YouTube looking up videos, looking up everything possible to understand what I was getting myself into, and there were literally no resources. So that's why I try so hard to like do what I do to help you guys get into it, because one, like it's not talked about enough in nursing, and two, at least you have an idea of what you're getting into. Like I'm telling you, like I didn't really know what I was getting into until I actually did it. So, but anyways, so I was gonna do another chart review with you guys. Just let me know if you guys find these videos helpful, because y'all not really saying much in the comments. Like I need y'all to get active in the comments so I know what you guys like and what you guys want to see. Like help me help you, okay? Let me know what you guys want to see. Because I also feel like with me doing those chart reviews, like I'm literally helping you guys get 2 steps ahead of the next person. Like you have an idea, you're able to grasp a concept or really understand what CDI is, and that's something you can use in your interview. Like you can say, hey, I have a friend that's in CDI, I'm your friend, okay? And you can say, I understand this is what it is. Because if you come in with that, you already coming in like a strong candidate, okay? So yes, let me know what you guys would like to see and if you guys found my videos helpful. So yeah, that's all I can think of on the top of my head. If I do think of more comparison options, I will definitely make another video on that. But I do want to say that I'm glad I made this decision. I'm 100% glad I made this decision, because I for sure did not want to be at bedside. And if you are tired of bedside or you're burnt out, I definitely recommend that you look into CDI. I do have many resources, so you guys can check them down below. I will have the links down below, resources to help you to get into CDI. I do have a video where I talk about steps to help you get into CDI. I definitely think it is a great transition. Definitely something you can even try, see if you like it. If you don't like it, you want to go back to bedside, you always have that opportunity. But I definitely feel like it is a great opportunity. It's a great option. I do think it's a hidden gem. And yeah, I definitely recommend it. Like I definitely want to like help teach others, other nurses who want to look into CDI. I'm trying to like do the best that I can to help educate you guys, to give you guys insight and input on CDI so that you guys can decide if it's something for you to do, because I know what it's like to be tired of bedside. Like trust me, I know. Okay, so yes, I definitely recommend it. I enjoy my career. So yes, if you guys have any questions, go ahead and let me know. Leave a comment down below. I hope you guys found this video helpful. So if you guys have any questions, just let me know. And I have many other videos talking about CDI, doing a CDI review. So just make sure you guys check them out, and also check out my free resources. Thank you guys for watching.